Hello everyone, welcome to Kranti Physio. Today let's discuss hip flexion and extension MMT. The hip flexion range of motion is 0 to 120 degree. The main muscles responsible for hip flexions are psoas major and iliacus, and the accessory muscle rectus femoris, sartorius, tensor fasciae lata, which is TFL, pectineus, adductor brevis, adductor longus, adductor magnus. In grade 3, the position of the patient is high sitting and hand will be supported for strong stability to avoid anterior or posterior pelvic tilt also, because it may increase the activity of iliopsoas muscles. Then ask the patient to lift his leg to off the table. If patient complete the full range of motion, then grade 3 is fine. In this grade, therapists don't apply any resistance. If grade 3 is fine, then progress to grade 4. In grade 4, patient position is same. Therapist is standing at the side of the testing limb. Then patient flex his hip in end range, then therapist provide a moderate resistance. If patient can maintain this position for few seconds, then grade 4 is fine. Then progress to grade 5. In grade 5, the position is same. Then the therapist will apply maximum resistance in the distal thigh. But therapist should not ignore the size of flexor muscles, as the size of iliopsoas is small, so don't apply more pressure. In grade 2, the full range of motion is occurs in gravity eliminated plane. Then the patient position is side lying, lower extremity flexed for the stability. Then the therapist is in behind the patient, and in one hand therapist support the other limb and in other hand support pelvic for stabilization. Then ask the patient bring his hip up to the knee. If patient can perform completely, then grade 2 is good. Then in grade 1, the patient position is supine line. Then the therapist support the testing limb under the calf with her one hand, and the other hand she has palpate iliopsoas muscles contraction. If the muscle will contract for producing movement, then grade 1 is good. In grade 0, there is no contraction of muscle. Then in hip extension, the full range of motion is 0 to 30 degree. The muscles responsible for hip extension are gluteus maximus, semitendinosus, semimembranosus, biceps femoris, adductor magnus, gluteus medius. In grade 3, the patient position is prone lying. Then the therapist standing just the tested side and stabilize the pelvic in one hand. Then ask the patient to perform hip extension. If patient complete full range of motion, then grade 3 is fine. Then therapist progress to grade 4. In grade 4, the patient and therapist position is same, but therapist apply a moderate resistance in the end range of the movement, just about the ankle joint. If patient maintain this position, then the grade 4 is good. Then therapist progress to grade 5. In grade 5, the patient and the therapist position is same. Then the therapist apply a maximum resistance after the patient complete the full range of motion. If the patient maintain the position, then grade 5 is good. In grade 2, the patient position is side lying. Then the therapist will behind the patient with her one hand support the pelvis and with other hand support the limb. Then therapist asks the patient for hip extension. If the patient can do hip extension, then the grade 2 is good. So in grade 1, the patient position is prone lying and the therapist will palpate the gluteus maximus muscle contraction. Then in grade 0, there is no contraction. So that's all about hip flexion and extension MMT. If you enjoy my video, then please like, share and subscribe my YouTube channel Kranti Physio. Thank you.